It's 2025, and the world is worried again. The rapid pace of global news has everyone on edge, and this time, the headlines are dominated by a new health crisis. This time, it's China facing a big outbreak of a virus called Human Metapneumovirus, or HMPV. The virus, which has been known to scientists for years, is now causing widespread concern due to its rapid spread. This virus isn't new, but it's spreading very quickly in China, and that has everyone concerned. The crowded urban centers and the high population density are contributing to the fast transmission of HMPV. People are seen wearing face masks, and healthcare workers are on high alert, donning protective gear to safeguard themselves and others. In this video, we'll learn about HMPV, how it spreads, and what's happening in China. We'll hear from leading healthcare experts, who will provide insights into the nature of the virus, its symptoms, and the measures being taken to control its spread. We'll also take a closer look at the research being conducted in medical labs to understand the virus better and develop effective treatments. It's important to be careful, but not scared. Families are taking precautions, such as practicing good hygiene by washing their hands frequently and avoiding crowded places. These simple yet effective measures can significantly reduce the risk of infection. Knowing about HMPV is the first step to staying safe. By understanding how the virus spreads and what we can do to protect ourselves, we can stay informed and prepared. Doctors are working tirelessly to educate the public about the virus, and infographics are being shared widely to provide clear and concise information on prevention strategies. Stay tuned as we delve deeper into the story of HMPV and its impact on China and the world. Human Metapneumovirus is a virus that infects your airways, like the common cold or the flu. Scientists discovered it in 2001. HMPV mostly affects young kids, older people, and people with weaker immune systems. It usually causes mild, cold-like symptoms, but it can sometimes lead to more serious problems like bronchitis and pneumonia, especially in those who are more vulnerable. HMPV can be tricky to spot because it looks like many other common illnesses. The usual symptoms are a runny nose, cough, sore throat, fever, and trouble breathing. These symptoms usually show up 3 to 6 days after you've been around the virus. If you or someone you know has these symptoms, it's best to see a doctor to be sure. HMPV, or Human Metapneumovirus, mainly spreads through tiny droplets that come out of your mouth or nose when you cough or sneeze. These droplets are often invisible to the naked eye, but can carry the virus over considerable distances. When someone who is infected with HMPV coughs or sneezes, they release these droplets into the air, potentially infecting others around them. This is why it's so important to cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Not only does this help to prevent the spread of HMPV, but it also helps to stop the spread of other respiratory viruses like the flu and the common cold. These droplets can travel up to 6 feet. In some cases, they can even travel further, especially in enclosed spaces with poor ventilation. This is why maintaining a safe distance from others, especially in crowded places, is crucial. When you are in a public place, try to stay at least 6 feet away from others to reduce the risk of inhaling these infectious droplets. It's also a good idea to wear a mask, as it can help to block the droplets from entering your respiratory system. If someone breathes in these droplets, or if the droplets land in their nose or mouth, they can get infected. This is why it's so important to avoid close contact with people who are showing symptoms of a respiratory infection such as coughing or sneezing. Even if someone is not showing symptoms, they can still be contagious, so it's always a good idea to practice good hygiene and maintain a safe distance from others. Washing your hands frequently with soap and water, or using hand sanitizer when soap and water are not available, can also help to reduce the risk of infection. The virus can also spread if someone touches a surface with the virus on it, like a doorknob, and then touches their face. This is known as fomite transmission. The virus can survive on surfaces for several hours, so it's important to regularly clean and disinfect frequently touched surfaces such as doorknobs, light switches, and countertops. Avoid touching your face, especially your eyes, nose, and mouth, with unwashed hands. By taking these precautions, you can help to protect yourself and others from HMPV and other respiratory viruses. Anyone can get HMPV, but some people are more likely to get very sick from it. These include babies and young kids, especially those under 2 years old, older adults, especially those over 65, people with weaker immune systems like those with HIV, AIDS, and people with long-term breathing problems like asthma. It's really important to protect these people from getting infected. China is seeing a large number of HMPV cases right now, especially in the northern part of the country. Many children under 14 are getting sick, hospitals are very busy, and it's putting a strain on the healthcare system. The Chinese government is taking some steps to control the outbreak, like asking people to wear masks again and restricting travel in some areas. There is no specific medicine to cure HMPV. Treatment focuses on relieving the symptoms and helping the body fight off the virus. Rest, drinking plenty of fluids, and taking over-the-counter medicines for fever and congestion can help. In serious cases, people might need to go to the hospital for oxygen, fluids given through a vein, or help with breathing. The world is watching the HMPV outbreak in China very closely. There have been a few cases in other countries, but no other country has seen such a big outbreak. The World Health Organization, or WHO, is working with China to track the virus and give advice. When an infectious disease spreads quickly, it reminds us that we are all connected. In our interconnected world, the actions of one person can have far-reaching consequences. This is why it is crucial to stay informed and take proactive measures to protect ourselves and our communities. It's important to stay informed about the HMPV outbreak and do what we can to protect ourselves and others. Keeping up with the latest news and updates from reliable sources can help us understand the situation better and make informed decisions. Whether it's through watching the news, reading articles online, or listening to briefings from healthcare professionals, staying informed is the first step in combating the spread of the virus. Simple things like washing our hands often, using hand sanitizer when soap and water aren't available, and being mindful of the surfaces we touch can significantly reduce the risk of infection. Hand hygiene is one of the most effective ways to prevent the spread of infectious diseases. Make it a habit to wash your hands thoroughly for at least 20 seconds, especially after being in public places or touching common surfaces. Covering our coughs and sneezes and using tissues or our elbows to prevent droplets from spreading. Respiratory hygiene is equally important. Always cover your mouth and nose with a tissue or your elbow when you cough or sneeze and dispose of used tissues immediately. This simple act can prevent the spread of germs to others and keep our environment cleaner, and staying home when we are sick can make a big difference. If you feel unwell, it's essential to stay home and avoid contact with others. This helps prevent the spread of the virus to those who may be more vulnerable. Employers and schools should encourage sick individuals to stay home and provide support for remote work or learning when possible. By being careful and informed, we can get through this together. Community support and solidarity are vital during these times. Whether it's checking in on neighbors, volunteering, or simply following public health guidelines, every action counts. Together, we can overcome the challenges posed by the HMPV outbreak and emerge stronger and more resilient. Thank you for watching. Don't forget to subscribe, like, and share to Roasting Rampage for more updates and information. Stay safe and stay informed.